It's a threat to Nakuru residents who usually seek medical attention from public hospitals, as nurses, clinical officers and lab technicians have threatened to down their tools, reason being the delayed salary of 2 months. Addressing members of the Fourth Estate in Nakuru, led by their respective unions, they have complained to the county government over delayed promotions, failure to hire replacements and harsh employment terms. They have now called on Governor Susan Kihika to live up to her election promises of transforming health sector, which of late have been deteriorating.
Tumekasirika and we want to communicate. Tunataka governor asikie, achue watu wake hawana furaha. Tunaumia in this county. Kama umefanya kazi, we are not here requesting, we are demanding. We've worked for our salaries na tunahitaji tulipwe pesa yetu. Hisi ati tunapembereza, we can't work. Arafu tunachukuliwa just for granted. Tumelipwa ya 1 month, of which I believe hiyo pesa yote imeenda kwa madeni. Watu wamerudi pale pale. When we are employing people, can we consider the people who have been working in this county? I don't know whether it is corruption or what. Unafanya mtu amefanya like 10, 15, 7 years in this county. But all of a sudden unapata when a chance comes to convert somebody permanent and pensionable, we get a stranger. Somebody maybe a relative or something.
Somebody now is being employed on contract in that they are employed because apparently with permanent and pensionable we will go on strike. That is the fear of our administration, and it's very demeaning, bearing in mind that if I don't have any job security, my work is haphazard. We have a lot of favorism in this county, so much such that it's something which is tangible. Yeah, you need to know someone to have something. Yeah, now what will our new generation do? Mentorship becomes a problem, because if this person has a favor, meaning this person has to play, you know, to the cards of the person who actually helped this person to get employment.
We have MPOX with us. We are looking at laboratory all the time. We can get infected, but we are not considered. Everyone else goes to the trainings. You find that when all goes bad, they come back to the laboratory. We are testing all the time, but you find that we are not considered. You don't look at those people, they work at night. Sometimes we are called. I remember last week, one of us was called to work, to deal with a client, but he was not able because there are a lot of samples at night. Daytime, we have only 2 people who are working. For example, let me give you a good example. In PGH, those who are permanent and pensionable are only 10. The others are contracts, and they are going every day, every any other time. And you find that we are going out. We are almost retiring. Tutawacha watu wa contract wenye hawajui chochote. Wewe utagojeka alafu kuja hapo unapewa bad results. Yeah? So it is very, very important to consider those people. Those who are professionals, we want to leave them with profession, na tuwaonyeshe mambo mazuri vile ya kusoma films and all other things.
Sasa hizi kuna challenge ya mgomo ya madaktari. Hata sasa hizi mnaniona hapa nimemaliza mkutano mapema sababu tuko na mgonjwa kutoka constituency yangu sasa hizi yako ICU, na sababu ya mgomo amepata challenge sana Nairobi, lazima nikimbie huko. Ile kitu naomba our doctors. Hii ni nchi yetu. Hatuna nchi nyingine. Na ni kitu mzuri sana tuongee tukisikizana. Na the Rome was not built in one day. Naomba tu madaktari wetu wasikizane pia na serikali na tukaweze kupata success story. Angalau tukuta madaktari wetu wamerudi kwa hospitali, sababu hizo strikes haki zimefanya tumeteseka. Sasa hizi hata mimi nasikitika zaidi. Ninakimbia Nairobi sababu ya rafiki yetu ambaye amelazwa hospitali, hajakuwa attended 2 days na kwa ICU. Sasa naomba madaktari wetu angalau wakaketi na serikali yetu wasikizane, na mimi najua hii ni serikali ya kuaminika ya William Ruto. Najua wataongea na wataenda wakisort once, slowly by slowly, and all will be sorted.
My name is Dr. Joseph Pantaleo. I'm the founder of Tomorrow Smiles Today. It's a foundation for medical and dental needs, specifically here in Lare, Kenya. We really want to promote dental cleanings. We want to prevent extractions from happening, and we want to promote the patients here to really come to the clinic and get dental cleanings at least once or twice a year. The tooth decay starts at all ages, but we're finding that if we can get the children and teenagers to come to the dentist earlier, then we can prevent a lot of decay from happening. What happens when a patient has high blood pressure is that it's very challenging for us to do dental treatment on you because of the dental anesthesia that we use. So if a patient has controlled high blood pressure, they won't bleed as much during a cleaning. High blood pressure leads to gingivitis, or inflammation of the gums, and we want to make sure that we control this as well, because by having inflamed gums, you'll create something called periodontal disease, which you also see here in this community. A big factor also goes back to dental cleaning. So my main goal here is prevention. We want to prevent gingivitis, periodontitis, and tooth decay here. We definitely see a huge increase in patients that we see every year that we come here. And I really believe that the reasoning is that we bring high qualified doctors with us. I personally vet every single doctor that comes here. I make sure that they're ethically and morally make really good decisions at all times. The goal now is to come at least twice a year, and with the help of the local government and the Franciscan Brothers, we're really hoping that we do make this possible. There's no reason that we can't come here twice a year to really provide routine dental care for everyone here.
Marĩtwa makwa nĩ Kega wa Ndung'u. Tuga pressure kana high blood pressure nĩ gũkorwo thakame nĩ ĩrahaica kana nĩ ĩrathiĩ gũkĩra gĩkĩro kĩrĩa yagĩrĩire gũkorwo ĩrĩ, na normal kana kawaida ya pressure kana kawaida ya thakame mũndũ nĩ abatie gũkorwo na mwena wa na igũrũ nĩguo twĩtaga systolic, nĩ abatie gũkorwo na 100 gũthiĩ 130, no kũringana na mĩaka hihi mũndũ nĩ mũkũrũ nĩ thiaga no ĩthiĩ kinya 140 no tuge ndarĩ na pressure. Naguo mwena wa nathĩ nĩguo twĩtaga diastolic, abatie gũkorwo wĩ 70 gũthiĩ nginya 89, no yanjĩrĩria gũkĩra 90 tukauga mũndũ ũcio nĩ aranyitwo nĩ pressure. Pressure nĩ ĩrehagwo nĩ maũndũ maingĩ mũno, mũrĩre ta kaingĩ na kaingĩ nĩ twendete kuongagĩrĩra irio citũ cumbĩ rĩrĩa ci metha-inĩ. Wa kerĩ, mũikarĩre kana maica marĩa mũndũ araikara, nĩ ũrenda gũikara rĩngĩ ũgaikara tũmaica twa gũkorwo ũikarĩte thĩ, we ũrona nĩ indo wĩnacio kana nĩkĩ, no nĩ mwĩrĩ waku ũrathũkia, tondũ angĩkorwo nĩ ũrakĩrĩa na ndũraruta wĩra, maguta ma mwĩrĩ ndũrahota kũmacina. Ũguo nĩ kuonania ona ngoro nĩ ĩrĩgĩa na tũmaguta rĩngĩ tũreka atĩa tũreyũmba harĩa na nĩ tũrĩcekunderia mĩkiha, ũguo karemwo nĩ kũhũra thakame, karemwo nĩ kũhũra kana ngoro karemwo nĩ kũhũra thakame ũrĩa yagĩrĩire. Age bracket ĩrĩa affectagwo mũno nĩ tuge nĩ kuma 35 years and above gũthiĩ na igũrũ.